Health Minister, Lord Darzai, will see a reduction in bureaucracy because we're getting rid of strategic health authorities and we're getting rid of primary care trusts. Ed Miliband.
Let me give him the answer to the question, Mr. Speaker. The number is going to go up from 163 to 521. Pathfinder consortia, health and well-being boards, shadow commissioning groups, authorised commissioning groups, a national commissioning board, PCT clusters, SHA clusters, clinical networks, and clinical senates. Mr. Speaker, is this what he meant by a bonfire of the Quangos?
If he looks at the figures of savings, he'll see we're saving £5 billion through the reduction of bureaucracy. That is what's happening. What we inherited was a situation where the number of managers was going up 4 times as fast as the number of nurses. What's happened since we took over, the number of doctors has gone up, the number of bureaucrats has gone down. Mr. Ed Miliband.
I'll tell him about our record on the NHS. More doctors and nurses than ever before. The shortest waiting lists ever. And the highest patient satisfaction ever. Now, he says that it's going to save money, but he's refused to publish the figures accompanying the new amendments to the health bill of how much he's going to spend. But maybe you can tell me this, because these figures are available. How much is he going to be spending on making NHS staff redundant?
Well, let me give him the figures on the costs and the benefits of reducing the bureaucracy. This is the question he asked. This is the question he asked. This is the answer he will get. Changes will have a one-off cost of 1.4 billion over the next 2 years, but over £5 billion will be saved in total during this Parliament, and over a 10-year period there'll be net savings of £12.3 billion. Now add to that the fact that we are putting £11.5 billion extra into the NHS, and he fought the last election pledging to cut it. Mr. Ed Miliband.
He didn't answer the specific question I asked, which was how much is he spending on making NHS staff redundant? The answer is £852 million being spent on making NHS staff redundant. Now, can he guarantee this House that none of those staff will be rehired to old jobs at his new Quangos?
What we're doing is implementing. Yes, we are implementing the £20 billion cost savings that were set out by the party opposite when they were in government. But the difference is we're going on with putting more money into the NHS, money that the party opposite doesn't support, so there will be more nurses, more doctors, more operations in our health service, and a better NHS compared with cuts from the party opposite. Ed Miliband.
Mr. Speaker, let me just ask the question again because he didn't answer it. People are very concerned. He's creating a whole new set of Quangos. Will he tell us this simple question? Can he guarantee that none of the people being made redundant will be rehired to do their old jobs at his new Quangos? It's a simple question, yes or no?
Well, I know that he has this extraordinary vision of how the NHS is run, but it's not the Prime Minister who hires every person in every organisation in the NHS. The difference between this coalition government and the party opposite is we're investing in the NHS, putting resources into the NHS, reforming the NHS in a way that's supported by the Royal College of Surgeons, the Royal College of Physicians, Tony Blair, Lord Darzai, most people working in the NHS, but not by the party opposite.
Order, the decibel level is... But order! The decibel level is far too high. The Prime Minister shouldn't have to shout to make himself heard. Mr. Ed Miliband.
Mr. Speaker, the whole country will have heard that he has admitted they're spending £852 million on making people redundant, and he can't even promise they won't be rehired to do their old jobs. And isn't the truth, Mr. Speaker? He promised no top-down reorganisation, he's doing it. He promised the bonfire of the Quangos, he's creating more. He promised a better deal for patients, and things are getting worse. What people are asking up and down this country is what is he doing to our NHS?
What the whole country would have noticed is at a time when people are worried about strikes, he can't ask about strikes because he's in the pocket of the unions. What the whole country whole country will have noticed is at a time when Greece is facing huge problems over its deficit, he can't talk about Greece because his plan is to make Britain like Greece. What the whole country will have noticed is at a time when the economy is the key issue, he can't talk about the economy because of his ludicrous plan for tax cuts. That's what we see week after week. He has to talk about the micro because he can't talk about the macro.
We're very grateful. Guito Beb.